debate. The honourable member for Yukon.
Thank you, Madam Speaker. I'm pleased to rise this evening to speak in support of this bill presented by my colleague, the Honourable Member for Courtenay-Alberni, and I thank the member for his dedication and leadership in this issue. While we've only recently met, I know he's long been an advocate for individuals struggling with mental health and addictions, and I would very much like to take a moment to thank him. These are issues very important to me as well. In our own ways, each of us has worked for a number of years raising awareness and striving to address the toxic drug crisis. He in this chamber and me in my former role as Chief Medical Officer of Health for Yukon. I was serving as Yukon's CMOH back in 2016 when the first fentanyl fatality occurred in the territory. Since then, Canada has lost more than 26,000 people to overdoses. Untold numbers of Canadians have had their lives dramatically changed forever due to the untimely and preventable loss of loved ones. My territory of the Yukon currently has the highest per capita mortality rate for toxic drug overdoses amongst the provinces and territories. And I cannot overstate how this has affected every single member of my riding. But we know this is a problem that belongs to all of Canada. As CMOH of Yukon, I worked with the Yukon government, First Nations and community partners to introduce improvements in prevention, clinical care, access to treatment, education and harm reduction. And I'm pleased that the Liberal government, of which I'm a proud member, has stepped up to address this toxic drug crisis. I know that without the multiple arrays of federal supports, we would not have had the successes in Yukon that we have had to date. The Honourable Minister of Mental Health and Addictions has already demonstrated strong leadership in this new ministry. Our government already recognises that problematic substance use is first and foremost a public health issue, and we are working to divert people who use drugs away from the criminal justice system and towards supportive and trusted relationships. We have a multifaceted approach building on previous action, including investments of over $700 million in community-led harm reduction, treatment and prevention projects, which are so important. And importantly, we have also received Section 56 exemption requests from BC, Vancouver and Toronto Public Health, and they are being reviewed on an urgent basis. Our government has also invested over $60 million to expand access to a safe supply of prescription opioids, also increasing access to life-saving naloxone across the country, including remote and isolated Indigenous communities. Since 2017, supervised consumption sites in Canada have received more than 2.9 million visits, reversed almost 27,000 overdoses without a single death at a site. And we're investing $425 million annually for community-based services to address the mental wellness needs of First Nations and Inuit peoples. Our government is clear that we will use every tool at our disposal to end this national public health crisis. Whether in Yukon or in any other location in Canada, though, there is more we can do, and there is more that we should do. Part of this is expanding and building on what we are already achieving across the country. Currently, there are effective practices in place that can be scaled up and shared. In addition, it is time that we formally consider decriminalization as a national policy. Decriminalization, simply put, means that we would no longer be considering simple possession of narcotic drugs and other controlled substances to be a criminal act. Rather, such possession speaks to a health issue that must be treated as a health issue. It's important to say, though, what this is not. Those who commit serious offences, including trafficking, will continue to receive serious sentences. And this enactment amends the Controlled Drugs and Substances Act to repeal a provision that makes it an offence to possess certain substances and make consequential amendments to other acts. In addition, it enacts the Expungement of Certain Drug-Related Convictions Act, establishing a procedure for expunging certain drug-related convictions, and provides for the destruction or removal of the judicial records of those convictions that are in federal repositories and systems. And finally, it enacts the National Strategy on Substance Use Act, which requires the Minister of Health to develop a national strategy to address the harm caused by problematic substance use. The Honourable Minister of Mental Health and Addictions was correct when she said decriminalization on its own with a toxic drug supply will not save the lives that we need. The key words here being on its own. The important step of decriminalization must be in step with all the other components, building on the work done over the previous years by all levels of government on safe supply, on education and reducing stigmatization, on access to treatment and better clinical management. We need to provide better training for frontline workers responding to these crises, and perhaps need to consider education and training for other community members, particularly for isolated communities. Safe supply, supervised consumption, better access to treatment, effective prevention, and decriminalization are all approaches that combined can help prevent more deaths. As we know, BC, Vancouver, Winnipeg, Toronto are all calling for the decriminalization of the possession of small amounts of illicit drugs. The country's largest mental health teaching hospital, the Centre for Addiction and Mental Health in Toronto, is also pressing for it, and we know it's a position shared by the Canadian Association of Chiefs of Police. It's also a position of the Canadian Medical Association and my own Yukon Medical Association. In addition to all this, all that the government has done to address this crisis in recent years, we do need an approach which will consider a broader approach to the issue, including decriminalization. These are critical discussions we must have, which is why I'm happy to speak to my colleagues' bill, support it, and help it get to committee. I think it's the direction we need to move in, and I look forward to working on it with this House. I believe to move forward, we need to speak passionately, we need to show compassion, we need to make sure we're doing all we can to get the evidence across as clearly as possible. Our decisions in this House should always put what is right for Canadians first, by following the evidence and facts, medical or otherwise. People are dying, we must act. This bill must be carefully and critically considered. I am very pleased that my colleague has brought this forward. I very much look forward to working with the honourable member opposite on this critical issue, as well as any other measures to address this opioid crisis. Thank you.
The honourable member.